my name's Colby. I am a clinical research nurse at Fox Chase. So my primary role is to recruit patients for clinical trials. We do the pre-screening to see if they're appropriate candidates. And then we do the consenting. We go through like an eligibility process, making sure that they're actually appropriate for the treatment. If they end up enrolling to the trial and they get treatment, we see them in clinic alongside the physicians to assess kind of the adverse events, how they're tolerating treatment, how it's going. That way, when these drugs eventually go to market, we're actually developing appropriate side effect profiles for them. And then as patients come off of treatment, whether it be for disease progression, side effects, or if they've just completed treatment, which is always very exciting, then we can kind of continue to follow them in the long term and see how they're doing overall. Are they having side effects late in their treatment process? Are they having overall survival benefits? So are they living longer than people that are maybe on standard of care treatments? So it's an exciting role. And I think there's a lot of opportunity here to get more exposure to what we do and to bring more nurses into this field. And so that's kind of where our project started. We just got an email to like the general nursing department last probably October of, I guess it would have been 2023, looking for mentors for spring nursing students for their internships. And it was forwarded to all the nurses in our department if anybody was looking for the opportunity to mentor a student. It's great for career development, that kind of thing. I was a tutor in nursing school, so I always really liked working with the students and helping them grow. So I jumped on the opportunity. I thought it was awesome. And then I was really excited that we actually had a student that was interested in clinical research. There's not really a lot of exposure to this field in nursing school. Students don't know that this is an opportunity for them. So I really didn't even know if there was going to be any interest. So there was one student that was interested. We kind of just like flew by the seat of our pants, honestly, with the program. She followed me around as much as I could. I placed her in a couple different opportunities that I thought were good for her. So I primarily work in thoracic oncology. So I see a lot of lung patients, but we are separated by disease sites. So she did shadow a couple of my colleagues in women's health, in GI, and GU, just to kind of get a diverse experience. And then we also did a couple other, like outside of the main experience, she was able to shadow in our ambulatory care center. And so she worked alongside the nurses down there and with the physicians down there to learn a little bit more about the flow of an outpatient oncology clinic and how physicians decide whether or not a patient might be a good candidate for a clinical trial. Do we offer them standard of care? Do we offer them clinical trial? How does this come about, really? So she spent a day in there to get some of that experience, and then she also spent some time in our Clinical Research Unit, the CRU, which is where all of our patients that get clinical experimental therapies, they get treated over there. It's a very specialized unit, so the nurses are able to watch the patients a little bit closer. They're able to kind of comply with the protocol procedures and that kind of thing. So she spent some time like on learning and understanding the, I'm gonna say like the flow of a treatment day for a clinical trial participant. And then, like I said, she kind of shadowed a little bit all over our department and Office of Clinical Research and focusing and learning a little bit more about the opportunities within clinical research specifically. Our goal always is to find better treatments for patients. We want to give them a better quality of life. We want to give them longer survival, and we can't find new treatments without clinical trials, and we can't do clinical trials without the clinical trial staff. We have wonderful physicians and scientists that have really great ideas and they develop all the medications, but they just don't have the time to spend with the patients really understanding their experience while they're on the medications, really understanding what kind of side effects and things that they're having. And so the clinical trial staff, I think, is really important, really crucial, honestly, for developing these therapies, and that will eventually then become standard of care treatments down the road. And so if we don't expose nurses or future aspiring nurses to this opportunity early, they just never know that the opportunity is there. And learning even a little bit more, getting into the role, I think nurses in general are maybe not necessarily exposed to clinical trials. We all know that they exist, but we don't know how they're operated. So I think getting into the classrooms and getting into their like clinical rotations and stuff and exposing nurses to this opportunity earlier gives them the opportunity to maybe then pursue it as a career path in the future. So we are very fortunate to be partnered with Temple University's medical school and their nursing school, and so it was a little bit easier, I think, for us to work with the nursing students over there. We're working with our educators that are a little bit more in tune with like partnering with some of the outside institutions to be able to bring more students the opportunity. Fortunately, being in Philadelphia, we have other institutions in the area, so there are lots of opportunities out there, I think, to bring students into this field. But you need the nurse mentors to want to do it also. And so I would be happy to be a resource for anybody that's interested in doing this, because I think that it's really exciting and it's a great opportunity. But we have to start somewhere. We are thinking that we will probably need to get into the classrooms a little bit more first. As I mentioned, we only had one student that was interested, which I was very excited that she was interested, but it's amazing that she is because it's not talked about in the classrooms. And so I think we need to start by getting into their research lectures and their evidence-based practice lectures and talking a little bit more about this opportunity. I tell a lot of people that when I interviewed for this role, my first question to the people interviewing me was, are you sure I'm qualified for this position? Because my understanding as like working in research as a nurse, you have to have a master's degree or a PhD, and that's just not the case in clinical trials. And nurses don't really know that. So I think we need to start by just telling them that right up front in the classroom, and then presenting this as an opportunity for them just to shadow and see if it's something that they like, if they're interested in. We're hoping that in the future we can offer it maybe even as like an externship so that nurses can come over the summer. It would be a paid opportunity for them, but just to kind of dip their toes in the water and see what it really is like to be a clinical research nurse, and if this is a path that they maybe want to take down the road.